recently we had a query from one of our viewers who asked us that she has these deep nasolabial or cheek folds, and she was wondering what would be the best option for it. Do we put in fillers, or does she do threads, or does she need a facelift? So she was not sure, and that's why she asked us what is the best option. I personally have stopped, or rather reduced, doing fillers for nasolabials. The problem being that we are dealing with an Indian population mostly, and we have thicker faces. The skin and the subdermal tissue is all a little more thicker, and like when you compare it with a Caucasian patient, you will see that you don't have as many wrinkles, but we have a sag. So this is the sag which happens. So this is because of the thick tissues. So a facelift is not a very common procedure that we do for our Indian patients. We do a lot for our patients from abroad, but Caucasian patients which have thinner skin and they have a lot of wrinkles and a lot of loose skin which needs to be excised, along with repositioning of the platysma and of the SMAS. So, but for our patients, most of them, we have what is known as a sag. The sag is responsible for the deep nasolabial folds. So if you can pull the fold back, then the sag is gone, or these folds are gone. So when you're younger, the face is tighter, it's all pulled up. So then you don't have a sag. As we age, gravity is pulling the face down, and that is the cause for the fold. The problem with using fillers is when you inject a filler there, you're adding more bulk, and we already have bulky faces. So if you're adding more bulk in an area which is already bulky, then you're promoting more collagen and more bulkiness there, and over a time that is going to aggravate the problem, not solve it. And it's a temporary fix. Yes, if you don't have the time, if you don't have this thing, it's a temporary fix. You can just fill up those grooves and you can do it. But I would rather prefer that you do an actual treat the cause for it. The cause is gravity, which is bringing your tissues down. So what you do is you try and reposition the tissues back. When you reposition the tissues back, it gives you, there are 2-3 things which happen. One, when your normal face, a young face, is a triangular face, as it is aging, it becomes a more squarish face. So what that does, a lift will again bring it back to things to their normal position. It gives you a V shape, which is a more youthful looking face, where the mid part of the face is broader than the lower part. So that it brings it up. It takes care of the lines. It repositions your malar pad of fat. This is your malar pad of fat, which in your smile it will go up and stay where it should be, but over a period of time this is dropping. So it brings the malar pad of fat to where it should be, that is on your cheekbones, and repositions a lot of things. So that helps it. So personally I would say that yes, if you have the time, go in and do a repositioning of the mid face using threads, which is a minimally invasive procedure. And of course, rare cases, if you don't have the time, you can use fat, or you can use fillers. Fat also is it's a surgical procedure. We still have to harvest the fat and inject it. Thinner lines, we still use fillers, which is a much simpler procedure. You can use fillers and you can fill it up. So there you go. So if you have a problem, if you have the time, then yes, address the problem right at the start. Do a repositioning of the tissues. If you don't have the time, then yes, please go ahead and do fillers and fill the cheek up. But I would rather do something which is going to last you longer and actually solve the problem than something doing like a small quick fix. Thank you.